Today, the Arts Commission Executive Committee and Metro Arts staff are joining by conference call. In a moment, we will roll call all the members present. This meeting will be recorded and posted within 48 hours to Metro Nashville's YouTube channel. All action items voted on at today's meeting will be reconfirmed at the next in-person meeting of the committee. I encourage all participants on this call to stay muted and use the raise hand WebEx function if they would like to speak. If any commissioners are having technical difficulties with any of these functions, please let me know before we proceed. Assuming everybody's good. We have been advised that roll call can be taken during the vote regarding the motion to adopt the governor's executive order. Given that, please make sure you state your name and vote clearly when I call your name to confirm that it is you responding for the record. I will now call for a motion that the meeting constitutes essential business of this body and meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans considering the COVID-19 outbreak and is permitted under the governor's executive order number 78. Someone please make that motion.
Well, since I am here,
Yeah.
can I make the motion and second it? Do you get to second it?
You can make it and I can second it.
Okay, great.
So I will second your motion. And let's see. I'm trying to follow my handy dandy thing. All those in favor say aye.
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 Mattia says aye. I don't know if I have to give you my name.
Jim Schmidt votes aye. And with that, the motion carries. I think that's all I have to do for run of show. Okay, so I think we are officially in our meeting. I think very quickly, we do have some minutes from the last time the executive committee gathered together back on October 15th of last year. And I think we're taking the opportunity to go ahead and approve those while we're getting together. Mattia, did you happen to see anything?
Well, I wouldn't have been at the meeting on October 15th because I was not on the executive committee. So I am going to go and assume that they are an accurate reflection of that meeting.
Yeah. Can you move to approve them?
I can move that we make a motion. I make a motion that we approve the minutes.
Okay, and I'll second it. All those in favor of the motion to approve the minutes of October 15th, 2020?
Mattia Powell and I vote aye.
And Commissioner Schmidt votes aye as well. And the motion carries. Okay, we got that out of the way. So the next thing we wanted to talk about, and Ellen had brought this up at the last commission meeting, and I thought it was something that we, given some of the timing of a lot of the public conversation about these issues, which I think was really what spurred Ellen's ask of us to consider this. Obviously, the legislature has been discussing a lot of what I would term as anti-transgender and anti-LGBTQ issues up at the Hill. That obviously bleeds over into a lot of different public conversations. I know the mayor's office has made clear that they're not supportive of any of these measures, and they think they damage the reputation of the state and the city. From our perspective, I think, and speaking as an LGBT person myself, I do think that it's an opportunity for us as an agency and a group to show support for communities that have really for the last several months been targeted. And that's not just the LGBT community. I know we've had concerns raised about the Asian American community and thankfully we haven't seen as much of that here in Middle Tennessee, but in other places I know that community is under attack. Obviously the Atlanta incident is something as well. So I know there has been some outreach and discussion amongst the care committee about this as well, and that there's been some discussion about potentially figuring out ways to be supportive of these communities and really broaden the support of diverse and really make sure that everybody understands we are a fully inclusive organization, and that bleeds into both our artists, our grantees, the organizations we work with, as well as within obviously the staff and our board as well. So I just say that all to open up why I thought it would be good for the executive committee to kind of talk about some of this. And I know the care committee has been having some of those conversations. So I know we'll hear a little bit about, Paula, what that group has also talked about as well. Will, welcome. Good to have you on here too. So you've joined us. But with that, I just want to kick it. Ellen, was there anything else you wanted to? I don't know if you're at work, you may not be able to talk, but since you helped spur this conversation, I want to make sure that if there's some other direction you think we ought to be taking this, or something else you'd like us to discuss, I'm more than happy to do that. Okay, she may not be in a place if she can do it. So with that, I'll kind of kick it open. I view this as a conversation. I think there's some things we can do. We do have a little bit of data. I know that the staff has pulled together about both our artists and grantees. I know there has also been some discussions at the city level about self-ID, which for the LGBT community has been something that has been worked on for a long time. The Nashville LGBT Chamber was helping kind of push that along through the Berry administration, and then obviously Mayor Briley's administration has kind of put those wheels in motion, as I understand it. And I think that's all being carried forward through the HR department. But Caroline, is there anything that you want to add to that? I mean, I think we have an opportunity here to, one, what I would like to see is, some way for us to figure out to, one, say to the community at whole that our artists, our projects, our organizations, we want to support an inclusive environment for everybody. And I think we just need to figure out how we get that message out, whether it's some policies. I know there's some good stuff. And Grace, I don't know if we want to run through the slides you had sent earlier, but I think that those were good things for us to consider too, some of the things that the care group is discussed. So Caroline, do you want to? I'm all over the board here, but
Sure. I mean, yeah. So we're here to sort of do what the commission would like us to do. I think there's several, pieces of this at play. I mean, we've certainly been talking about statements of support or resources we can have on hand, or just responses to these incidents when they happen. Certainly, we want to have a conversation about that, and that's been started at the care level. And then I think the other piece is the, language in our funding guidelines or any sort of recruitment that we're doing. I know procurement has some language that they've been able to sort of use within their process. And so I think that opens up some doors to us. And I think legal can certainly help guide us in what we can and can't do. I mean, I think we have to be careful about, we can't make funding decisions based on demographics, and we can't require it as far as I know. But those are areas we can research and come back and sort of say, like, here's the areas where we can do something. Here's where we can, do the optional question, but we can't require it, kind of thing. So I think that's kind of the space we're in now. And then, Janine and her team pulled together this information that was sent out, and we can certainly run through that. And then I think she had some great questions, sort of framing questions at the end about, where do we go next?
Okay. Janine, do you want to run through these real quick and kind of give us an overview? I'm not Janine.
I don't. Janine's not in the meeting. I can just kind of highlight real quick that what she's pulled together here is, obviously we do have some boxes which we shared with you on our applications that sort of say, which of these demographic groups do you fit? It has been inconsistent. A lot of this just started in the last year or so as far as asking these questions. And certainly data that we have collected is informing our FY22 applications, closeout forms, any sort of program directional changes, and project locations. So I can go to the next slide. And so this was the data that we actually had. 12.5% of the lending library applicants identified as LGBTQ plus, 27% of learning lab applicants back in 2018, 55% of Thrive in April 2020, when we had a lot of good data, had at least one artist on their team identified as LGBTQ. And then 19% of, back when we did the anti-racism transformation team, which was sort of the precursor to CARE, we had the data that 19% had sort of made that declaration. We can go to the next slide. And this was, I won't read all these, but just some excerpts. We did add in the past year a cultural equity scoring criteria to the Thrive application and guidelines. So it's something we might consider across the board in different applications, because what happens is, we develop funding guidelines in the various teams or, artist applications. And so we're sort of trying to create some continuity there between Janine's team and the public art team. If they're putting out a call to artists, it might not look like the Thrive application, but we just want to make sure we're collecting all that data across the board. But certainly we get a lot of anecdotal, quantitative data from these applications. We can go to the next slide. So her suggestions were applications, like I just talked about, standardizing across the board, making sure we're asking the same questions. Closeout forms, we can add, or we are collecting demographic data, but just making sure that's standardized. Community engagement, understanding and tracking what outreach means, and using some additional analytics. That cultural equity criteria, looking at that, maybe moving that across all programs. And then the equity lens tool is something the CARE group has developed, and it's sort of a screening tool for any program or policy or anything we're doing to sort of ask ourselves some questions around equity. And Paula might could speak more to that. And then next slide, I believe, was the questions. So guiding questions. So where do we specifically want to go? What groups do we want to identify, track, and reach out to, or do more engagement with? What is our role in that? What are our goals? And then how do each of the committees sort of intersect with those? And I think that's a question for, how does CARE work with this? How does Public Art Committee and Grants Committee, how are we all working toward the same goals?
All right.
Turn it back over to you.
Okay. Well, so I think those are all great kind of guiding questions for us to figure out. And I also think the recommendations that are on the previous slide are stuff that, frankly, we ought to just, I think we ought to do that for a lot of different populations, not just in the LGBTQ plus conversation. Do we have like a library of, I don't want to say resources, but for our outreach to various groups, do we have like a Rolodex of all the various communities that we want to reach out to as far as diverse, and I'm thinking, Asian American community, the Kurdish community, Latino community. Because I'm viewing this from a much broader thing than just the LGBT issue, frankly, because I think I want to make sure that we're fully inclusive and that we are reaching those groups.
I don't think we have sort of a list or check boxes or anything like that. I know CARE has discussed this quite a bit recently, and in the last retreat I attended, we talked about this idea and sort of, is there a project where we do some sort of asset mapping of, where do we have funding going? What communities are we missing? What cultural identities are we not serving? And I think that's a bigger question. And certainly we've tried to answer that question through various programs, like through Thrive, through Learning Lab, and in some very direct outreach and recruitment of artists. But I think, and this could be part of our strategic planning process. I think it's something broader that we might want to look at and sort of map. We certainly are working on it, and there's different projects ongoing, like with the data clinic project that we're working on. They're taking our funding data and sort of overlaying that with demographic data around the city. They're looking at schools data, because we can get a lot of great demographic data from metro schools. and sort of just, starting to layer that. So I think in the coming months, we will definitely have more information. I think that's a great sort of project or initiative to sort of really think about that more and map it.
It seems to me it would be a helpful resource for us to have, because I think we could utilize that for, when grant applications open up or artist calls and those type things. Because I think one of Ellen's questions during the commission was, do trans artists or, specific community artists, are they getting outreach? And that's a good question. I know it's hard to reach everybody, but it would be good, I think, to expand our world as much as we can and figure out if we are reaching everybody. I'm not sure how we measure that, but we can figure out a way to do that.
Carolyn, this is Mattia. I appreciated the idea of I know we have a lot of folks that have connected through the Arts Commission through various ways, whether or not they apply for a grant, they've sat on a panel. We have a lot of people touching the commission, and then just anybody that has come to an exhibit or come to an event or been part of a project. So I know that part will be much harder to track, particularly unless we have a way for our grantees to, I think we asked them to report back, on. Well, okay, here's the question. When we ask our grantees to report back on if they're doing some sort of engagement, do we ask them any demographic data? We just ask them general information about, who came and how many people came, and that's it? Is that kind of generally what we ask?
I believe we are asking demographic data. I'll have to look at that, but I think the problem is we're not quite sure how accurate it is. If you're just looking at audience or
self-reporting.
Yeah.
And honestly, I don't want them to I feel like it's hard to put the burden on them to do that, to track their, demographics, particularly for some of our grantees that just, are doing smaller projects. But I wonder if there's a way we could potentially, maybe, and that's something we should think about as an executive committee, if we could put some resources behind tracking it a year or so, or tracking specific projects so we can get a better idea. Because I do think part of that mapping process, some of it'll be easier because we know who has connected to us through a grant or sat on a panel. But then how many people are connected to the arts community, I think, is a different, outside of that, how many people get connected or plugged in through an exhibit or a project is different. And I think that'll give us a better understanding of who connects to the Arts Commission. And then we should start thinking about, okay, we've got people missing. How do we better connect to them? And I think, I know that the staff does a really good job at making connections and are really engaged with community partners. And but I know there's a lot of folks that probably may not necessarily have a program that would specifically fit with the Arts Commission, but might be able to share opportunities out to a specific community, right? Because they, care about art and they want to make sure that their community is represented in these spaces. So, I wonder if there's opportunities for us to kind of expand our community panels, not in the sense of their community panels being the folks that judge the applications, but how can we form some level of community group that could share opportunities to come out through the Arts Commission so that we can make sure all those opportunities are shared amongst the community. So that's one thing. How do we maybe put together some sort of community outreach group that are partners with the Arts Commission as a way to get our opportunities out to various communities? I don't know if that's something that's too much of an ask, but it's just something I thought could be helpful. The other thing that there's a wonder a little bit is, I think we've done for some of these, and I don't really know what the solution is, but it's just a thought. I think that this year we've seen a lot of our grantees really respond to the time. So we had a lot of art projects, some because, there wasn't a lot of choice around it, but there were a lot of art projects that focused on COVID. And there were some specifically that did, projects around, trying to get students to cope through COVID or tell their stories. And I think, a lot of the things that are happening are really moments of now, and people And I feel like there should be a way for us to respond to some of the things that are happening in the community, because I think art is a great way for people to show support or share empathy or compassion or really respond to a moment and get people connected. But I know our grant process and the way we work sometimes doesn't necessarily give us an opportunity to respond to that moment of now. So I just wonder, how can we, is there opportunities for us in a moment like now where we've seen several things happen? Is there a way for us to quickly respond with the art community? Is a way to do something art in the art space to support some of these efforts, some of these things that are going on? Like, could we have done an LGBTQ art project with the students, or could we have done, worked with an API community artist to do something? Like, is there a way for us to respond quickly to some of the things that are happening in the community that allows us to process it through art?
I'll just respond really quickly from like a logistical standpoint. I think the answer is no, because we were already at maximum capacity for what we were doing. And I think that was part of the problem, like in the last month or so, we were like, oh, we'd love to do this, or we'd love to do this thing, or we'd love to talk, do vaccine advocacy projects, or, there's so many ideas, but there's no structure for that. So I don't know if just something that's coming to me right now is like, is there like sort of an ad hoc committee of the commission that we can pull together quickly in incidences of emergency and or response to sort of say like, we're the response team, we're going to get together and sort of make some decisions about, maybe we could set aside some level of funding or bucket of money to sort of disperse as needed or something like that. Because I just feel like we're having a hard time sort of managing just the day-to-day, the grants process and the things we're doing. So how do we then have another, 10 to 20% capacity held back for the things we need to just get out the door? I think about like lending library. Last year was an idea to sort of say like, let's purchase artwork from local artists to help them, let's get this into the hands of, citizens, artwork. But that's taken a full year, to sort of implement. So I think that's my concern. And then I think just to give you some background on staffing, I mean, we're sort of building Janine's team to be able to respond to this a little bit better as far as the data collection and the work that we're doing there. So I hope, we are doing that. So I think one of the requests we made to the mayor in his budget was an additional person to just sort of manage some of this data and impact measurement. So I feel like that's coming into place, but I don't know how to answer the, how do we sort of rapid response team or something to sort of do the thing that needs to happen today, or, and then the commission too, it's like we have to call a meeting and everything has to happen in a public meeting, and that takes a month. And, so I love that idea. I'm just not, and that's something to think about, like how do we actually implement things?
No, I think that's fair. I assume that all the things that you mentioned, but I just wanted to throw it out there. And I know we have I think the Thrive program is probably one of the programs that's the most nimble, right? Where we can get, it happens a couple of times a year, we do 2 rounds of that. And it also is a low entry point for artists. And this is just I know every year we're always strapped with like what funding opportunities we have, because we haven't, our budget hasn't grown in the last year, in fact, probably has shrank. But I think, one of the things we might think about is, if we're talking about, when we start talking about strategic planning or talking about what the next few years look like, really trying to think about how we can increase Thrive funding, because that seems like a good space for us to address or to make sure that we're connecting and getting people connected to the commission, and then getting them ready for like a much bigger grant. But like, I just think the Thrive program has a lot of potential to really reach out into the community. But I know we're always limited with the projects that we can, like this year, of course, we had a lot of projects, which was really, really great. But we didn't have enough funding to fund everybody. So I think, I think there may be an area where we should think about how can we increase funding, overall arts funding in general. I think that's something we should be always working towards. And then how can we increase some of the funding that goes to the Thrive program to help connect?
Yeah. Well, Mattia, I agree with everything you said there. And I do think that Thrives does seem especially I think a lot of our projects have touched on a lot of different aspects of very timely topics and things that needed to be addressed in the community that impact a lot of different aspects of the diverse communities we've got here. Nimbleness question about how quickly we can act on that, I think, is always going to be a problem just because we're a metro agency. Some of what I was thinking is, Caroline, even a communications message out to the communities in some way, I think could be helpful on some of this, because it gives, I think, the broader community and specifically the communities that are impacted by some of this, at least a message that we are here, the artists that are part of that community, that we are here, and that when the time comes, we want to be supportive of you and we want you to engage with us and be involved. So even some communications messaging in some way, I think, could be helpful in that aspect. I'm not certain how to do that yet or what the messages necessarily need to be, but I mean, that seems to me to be something we need to consider too, is, how do we get those messages out?
Paula, I was going to say,
tell me what
all of this is what CARE is doing. So I was just giving everybody the space. And then, so let me start with communication. We have a working group for internal and external communication and what that looks like for getting our messages out, the commission's messages out to a broad and diverse section, or not even section, but just the diverse communities and neighborhoods in our county. So we're working through that now. That list of kind of who are we missing, that kind of comes in with the equity lens questions, which talk about, who has historically been left out of this, who have we harmed. So there's a lot of that we're working through. So that's for external. Internal as well, how do we communicate? So one of the big things that we had a meeting just last week on, when there is a tragedy, or something happens within a community, how do we respond? And, I think it was the week of the Atlanta shooting. It was also the week of spring break for Metro. And there was a kind of a gap, if you will, between how do we respond, when do we respond, who should write the response. And so we went through all that. And what we ended up working down to is that we don't necessarily need to always have a written corporate statement. We could actually just use art as our medium to communicate within when something happens. So whether that's a quote from Maya Angelou or a artist that, maybe somebody from the Lending Library, maybe they have maybe there's a painting that depicts kind of what happens, or maybe it's just an opportunity for us to use one of the Nashville murals around, just to kind of use that as our space instead of recognizing. I think Trey said it very well. He said, art is our ministry. So let's stay within that space. And so that for us kind of started to move into, we're going to have another meeting, Jim. We're going to do another retreat in June. So we'll be
for you.
Yeah, we have meetings. That's what we do. But in Caroline, I like your idea of the whole mapping data. And I think that information will help us with that external communication plan and I'm not saying we're developing plans, but it's just where can we do better around making sure that we're not, engaging in policies or engaging in practices, I should say, that are exclusionary for others. So we're kind of all in that space together. Does that help?
Yeah, it really does. I figured y'all were having some of those conversations, and I love the idea of using art as the communicating tool for the response to whatever the situation is. And I think that's something that, Caroline, the staff and team, if there is a local artist from that community who has, or if there is a piece of art already in the community that can be part of that response, even just a comforting response, I think it would be something to show that community that they're respected. And I think there's a lot of power in that. So I love that idea. I don't know, do we need a actual policy to determine when that is utilized, or do you think that's something you just feel comfortable working within the staff to determine when that response is necessary? Or
if from CARE's perspective, I think we're still figuring that out with the help of staff. One of the things we did talk about was developing a database or a cache, if you will, of just things to pull from. So in the event of maybe not having to wait for us to have an official, not public notice, but an official statement, just to be able to say, okay, this picture can be, or this item can be used to express X, Y, and Z given this tragedy. And then if we need to develop a public statement, then so be it. But at least initially, especially through social media, we can start to push that out. That's kind of the initial thought. So we just had that conversation last week, and that was just kind of our working group meeting. We have our actual committee meeting next week. So we'll be kind of talking through that a little bit deeper.
Well, I think you can take the message back to the CARE group, and I'll try to sit in on that one if I can. I mean, speaking for myself, and Will and Mattia, I mean, I'm fully supportive of that, and I would like to try to move that sooner than later, just so we have that structure in place for Caroline and her team to pull the trigger when they need to and move quickly, because I think that's it's a great tool for us to use. And I think it speaks to the our real goals of our entire commission around improving equity and having a diverse pool of artists. So.
If you don't mind, I think that would be amazing. And I think Emily on our staff does an amazing job of creating these sort of structures and, charts and all this stuff where she can just pull and sort of have the content ready to go. I do think it might be a useful conversation in the future to say, like, okay, well, who approves this? Is it just me as the executive director working with the communications person? Do we just sort of decide and do it? Is that part of this, planning conversation, or is it something we want to bring the executive committee or the chair into to say, like, hey, because of the sensitivity of this messaging, just want to let you know this is what we're planning. I mean, those are questions we could probably answer through that CARE conversation and through that lens.
I mean, I would say it would probably be a conversation, and just for a line of command here, I would think the two chairs involved with the CARE committee, I mean, it could just be as quick as an email to say, hey, this has obviously happened. Is this something we want to, engage in sending some messaging out about? And, I would feel comfortable as long as someone on the commission sees it and kind of gives a thumbs up. I don't have any pride of authorship. I mean, I'm happy to have that run through whoever the chair of the commission is at the time, but the CARE committee seems to be especially attuned to those things. So it might make sense to have the two board members that are on the CARE committee at that time be the one to kind of give the thumbs up to you. I don't think we need a full commission eyes on it. I think you need one or two people to just make sure you're not stepping into something you don't realize you're stepping into.
And I think, Jim, you bring up a good point, and that's something that we I don't know that we fleshed it out completely, what that looks like, and then who is the one who says, this is still in its working stages. Let me just say that. But these are all questions that we're trying to figure out, because one, you want to be very sensitive to the group that has been most affected, and it may not be and we need to make sure that we pull in that group and say, is this okay? Because we don't want to be offensive. And so there's a lot of moving parts in that. And then that group is, maybe they've been the victim. So now are we asking the victim to make us feel okay about what we're doing, right? So there's so many layers, and we just want to make sure that we're thoughtful in the process. So I think asking all these questions are good, and this is just something that we're going to have to really take a deep dive and say, okay, this is the process, and we might get it wrong a few times, but let's at least figure out what that process is so that we can get it right eventually.
So y'all meet next, is it next week, Paula?
Yes, on Wednesday. Mm-hmm.
Have y'all set up a timeline of when y'all think you might have the structure of that, or is it still early? It sounds like it's pretty early in the conversation.
I mean, literally, we just met last week, and so kind of a subcommittee, and then the committee meets, and so we'll bring it forth, and I think it's going to be a big agenda item. But we can, as you said, move quickly on it. I will let them know that this conversation happened, and that we will be moving forward. That we need to move forward. Like, let's make this a priority.
Yeah, I think it's a good deliverable. I mean, I think it's, as far as something coming out of the care group that I think is tangible and good and sets up a process that hopefully, helps increase the work out in the community. I think it's a good one to kind of take and run with as quickly as we can, and obviously as cautiously as we need to not put something in place that's going to inadvertently trip us up.
And that's exactly what I think we are being mindful of.
Cool. Deal.
Well, I mean, I would say, Paula, it sounds like you guys are doing a lot of the good work, and everything you said so far is everything I think is great, and I agree with, and what should be done. So it's exciting.
Well, thank you both. The committee is doing tremendous work, and then the staff is fantastic. So we have some tough conversations, and we have some big, boulders to move uphill, but I think we all respect one another, and there's a level of trust that's there, so that it makes the work a little easier to do. It's still hard, but it's not, painfully hard, because we actually genuinely like each other.
That's good. That's always a good starting point.
Yeah. Mm-hmm.
Commissioner Schmidt, I think Will Sheik's hand is up.
Oh, so go ahead, Will.
So patient.
Hey, so picking up with equity, sitting here thinking, gee, we could do a whole lot for equity if we had more money. I was looking back on my notes. We had a meeting on January 16, 2020, when we talked about arts funding, looking at peer cities. Portland, Oregon, smaller than Nashville, has $10 million in public art funding. Nashville has 2.4. I would love for us to pick this back up. I think the pandemic is not in the rearview mirror, but I don't think that there's anything wrong with us setting some strategy about how we want to increase arts funding in Nashville. Can we get this back on our radar?
Yeah, it's definitely something that I think we need to restart those conversations again too. I think given the budget situation last year, it obviously got shoved over to the side, and it seems like things are righting itself one way or the other, as far as our potential for get a larger stream of funding going, either a dedicated source of revenue or some other means, just by increasing it through the budget. So my goal would be to re-engage that group again. I don't think it's going to happen this budget year, but I definitely think it's something that needs to be back on the table.
Yeah, and I'm thinking not just through the budget, but I'm also looking at other revenue streams and some sort of out of the box ideas. We came up with some really crazy ideas last time we met, and I followed up on one of them and found out it's possible that something could come of it. So if there's a way we could meet and really focus on the money, that'd be great.
Okay.
I agree, Will. I mean, that's, my whole point with the Thrive is like, I think that's a great program for us to start, when we're talking about engaging more artists. But I mean, I feel like we're always playing like, dominoes. Or not, dominoes is not the right game. Clearly, I don't know dominoes, but we're just basically, moving around the buckets because we haven't had any, additional funding in a lot of years. So we actually have got a lot more people engaged with the commission, but that also means that we have less money to go around when we have more people engaged, which is what we want. We want more communities to be engaged. We want more people to be able to have opportunity to get funding. But if our pie doesn't, if we don't have more funding and we have more people wanting to get funding, then that means everybody gets less. And so we've really got to increase, our funding. I mean, that's
Yeah,
just something that needs to happen.
Here. Rather than having people compete for more slices of the same pie, let's get 2 pies,
Grow the pie.
4 pies.
Yeah.
Mhm.
It's about growing the pie. Well, I'll reconvene. I know we had the group kind of pulled together, and then obviously the budget imploded 2 years ago, or a year ago, however long ago that was. But I'll pull everybody back together and we can start that, because I do think, funding helps address some of these things that we all want to do. So
Thanks, Commissioner Schmidt. I'll shut up now.
yeah. Well, you're going to be there too, Will. So get ready. We need you.
I'm ready.
Okay. And I'll need to, Caroline, if you can. I know that Marcus was on there before, but he's off the commission now. I think I just need to I need to see that list of who all was in that group. Jane was on there. Will, I know, was there. Mattia. I don't know if you were part of that.
I don't think I was around.
Yeah.
Maybe. I don't remember them being on there.
It was the executive committee and a couple of folks that are deep in the government space, usually figuring out how to do this.
I'll look at that, and I'll also, we might have some other business to discuss too, because if we're kicking off our strategic planning, we probably want to bring that group together. And then I think, there's going to be a lot of federal money coming in, as far as, like what we got last year with CARES was $2 million. I mean, we have been seeing crazy numbers, like 12 million in Cincinnati is what's going to arts and culture from some of the federal money. Chicago just announced 60 million going to their creative community. So we might also want to talk about strategies around what, do we want to make a request for some of those federal dollars that are coming through?
Yeah, the amount of money going into these local governments from CARES 2 and 3, and there's potentially another pot. It blows my mind, the amount of money that's coming in for a state that, as far as budgets go, we weren't hit nearly as hard as a lot of places, but I do think there is potentially a play for us to go in with a big ask to the mayor's office. They are probably going to have the flexibility to do a pretty big chunk of money if they want to. So we probably need to circle this group up sooner than later, and I can dig around a little bit on the CARES funding side from the state level, because a lot of this money flows to the state down to the locals again. It's just a pass through, but try to figure out what the ask can be, because there's no reason it can't be in the millions.
I think we should be on that for sure.
So
I would like to advocate for a full-time position for the CARE committee, so that
you need it with all the meetings you all have.
Yeah, we do, so that Janine and Grace can actually breathe and Trey.
Exactly.
We need a staff person.
We need it could be like a diversity and inclusion officer position, something to that effect. And that could even be like a community outreach position. You could fold that in there to, work with all these different neighborhoods and cultural groups. And I do think the asset mapping we mentioned earlier is something that needs to be at least looked at and revisited, and we need to build up that database. It's always going to be changing over time, especially as the city has grown so much. I just think that would be a useful tool for us to have.
And I will say, I think we there are some communities that we do touch. I know when I joined the commission, there was programs that I didn't know existed until, I joined here, like, the big Chinese festival that happens that we were funding for. I know at least a couple of times we funded that.
Yeah.
But I'm not sure if they even did anything last year with COVID. But so we do have some reach, but I definitely think, if we had more funding and more capacity, we could reach more.
Anyone else have any other thoughts about? I think that one thing I really wanted to figure out, it seems like CARES is taking this and running with it, and is the communication tool that we could have. And I think it sounds like they're having great conversations. So I want to help and be supportive in that as much as we can as an executive committee. And then I think looking at some of the asset mapping things and the outreach that's done through our grant programs would is something we need to continue to look at as well. And then obviously money helps us. We can outreach to more people. We got more money to hopefully loop people in and fund. So anything else y'all think we need to touch on? Ellen, anything you want to add if you can?
Hey y'all, I'll be honest, I've been in and out because I am at work, and what I have heard sounds amazing, and I really appreciate you all taking the time to consider this, and I look forward to watching most of this meeting on YouTube.
Absolutely. It's all good. Appreciate you listen in. So Caroline, just so I understand too, on the self-identification for artists and organizations, so that is already built into our application process and all that. So that it's just early. It's kind of the first time we've done this since Metro just started it. But all that is built in structurally already for collecting. So the buckets we collect are obviously persons of color, LGBTQ, obviously male, female. Do we need to?
Yeah. Oh, sorry. I was going to look up that list, but go ahead.
Didn't have it in front of me. I was just trying to remember it off my top of my head.
I don't have it handy, but yes, in those categories, yes. And then I think seniors, youth, persons with disabilities, maybe also on that list.
Are there any other groups that we're missing out of that pool? Are there any other things we're not tracking that we should be?
You know, that's a question we can take to CARE.
Well, it seems like there should be, and I probably need to just talk to my other half, Joe, who's does this for a living, and he probably has a full inclusive list of the various identifying factors that are, used in self-ID for most, both business and then obviously with local governments too. So I'll ask that as well, and when I get that list, which hopefully he has, then I can share it, Paul, with you, and then if Kara wants to look at it and see if there's anybody we're missing out of that, then I'm happy we can look at that. But I think sometimes having the data helps you tell whether or not you're actually reaching the community. It's a measurable thing, and I think that's important. So I'll try to get that list, and Paula, I'll connect with you on that. And
okay, Caroline, sounds good.
And if there's anything else that that you run across from other arts agencies in the country, then we might want to look at doing that. But nothing comes to mind except what we have already. But there's always something else out there that I haven't thought of. Okay. Anybody else have anything we want to touch on or see what we can be helpful? Paula, if CARE needs anything as far as resources or additional people to get engaged and involved, let me know, and I'm happy to volunteer some other friends on the commission to jump in too.
All right, sounds good. I'll keep that in mind.
Okay.
Thanks for that offer, Jim.
Yeah, absolutely. Caroline, anything else we need to touch on while we're...
Yes, there's actually one other order of business for the executive committee, and I think Ian's here to answer any questions on, you have to do my review, like my performance evaluation as the executive committee, and those are typically, HR typically wants those around June. So Ian, I don't know if you want to talk through, or if that's okay, if we could talk through the process since you're together today. We figured we'd give you the primer and get ready to do that.
Okay. Yes, I guess logistically, I think it makes probably most sense to provide the previous year's evaluation with Commissioner Submit to begin to develop the initial evaluation. And then because the executive committees are pretty short, I think in the executive committee, you guys can review and make any edits that are needed and then finalize the review in June.
Okay. Is that process laid out? Because the executive committee does the review, but there's also, I'm assuming there's input from staff and other folks as well, or is it just a review of the board?
In previous years, staff has provided, basically managerial staff has provided feedback on agency competency, basically, with the executive director. So, because that's sort of like basically in the evaluation categories, that's like the one kind of feedback area that seems to make sense to provide, because the other things are like, you know, interactions with governance and things like that. So it probably all levels of staff might not see Caroline interacting with council people and the mayor, and I don't think that's a fair way to evaluate that, but that is up to you guys as executive committee to decide as well. So if you need that, I can gather that. The biggest issue is just avoiding communication between executive committee members outside of the meetings. So that's why I think it would make most sense to deliver it directly to you, Commissioner Smith.
Okay, Ian, I think that's probably a good course of action. So if you can just gather that and get it to me, then we'll
Sure.
And then we'll call together the executive committee after we get that, and then go from there. And we'll get it done by June.
Sure, that sounds great. And would you like me to gather the managerial feedback?
Is that the process that's been? I'm happy to do that. I've not been through one of these where I've actually had to do it other than give input. So I just need some guidance on.
Sure, I could.
I'm happy to do it if that's more appropriate, or if Ian, it's something you've done before, and happy to do it.
I'm happy to do it and provide it with you along with the previous assessment, and so that way you just kind of have everything, and you can include it if you want, and if not, we can just disregard. Or
okay, no, that'd be great. We will get that underway, Caroline, and I'm sure everything will be great on it, but we'll work through the process. Anything else? At the next commission meeting, are we going to talk about the strategic planning RFP stuff, or do we need to do that within the executive committee?
That's a good question. I mean, I think that larger committee we were talking about earlier was kind of the strategic planning and funding committee. So if we had that in early June, we could maybe have a conversation in that committee and then bring it to commission a meeting. I think well, I won't go into the procurement situation right now, but we're working on that. We hope to have a consultant selected, I would hope by June. It's in process. So certainly we're working on that, and we'll have something to talk about, hopefully.
Okay. Good. Okay. That's all I've got. Mattia, Will, Paula, anybody got anything else?
I'm good.
Okay. Well, we'll pull all this stuff together, and then Paula will engage with CARE and get this moving. So I appreciate y'all's time today and look forward to taking next steps.
Thank you, Jim.
Thank you so much.
Y'all have a good day.
You too. Bye-bye.
Bye.